Welcome to the Wellness Law Podcast, where wellness and the law meet for contemplation and collaboration. This podcast is brought to you by the Center for Health and Wellness Law. I am your host, Barbara Zabawa.
Suzanne Hunt to the Wellness Law Podcast. Everyone meet Suzanne. She is assistant professor at the University of North Carolina, Greensboro. She's also the director of undergraduate studies for the Department of Public Health Education, and she teaches courses in health policy and other types of public health related courses because apparently she is an expert educator and also expert in wellness and public health. And I'm thrilled that she is here on the podcast today to talk about her experience as a public health educator, as well as I got to know her when she was part of the National Wellness Institute. So welcome, Suzanne.
Thank you for having me. I'm excited to be here.
All right. So before I hit record, we were having a nice conversation, very lively conversation about the difference between public health and wellness. And you mentioned that every year when you talk to your students, you get on a soapbox and you tell them you want to convey a message. And I was hoping you could convey that message to the podcast listeners.
Sure, absolutely. And I have a few soapboxes, but one of them, as what I call a public health practitioner, is the concept of wellness. And is it different than public health? Is it this separate entity? Are we one and the same? How does that work? And as someone who obviously has a degree in public health, has done research in public health, but really has this kind of background in health behavior science, also as a health coach, I've often wondered, why do we tend to talk about these things so separately? When it comes to public health is this kind of systematic approach, and we're looking at health education specifically, or we're looking at policy, versus wellness is very individualized, and it is more of something that kind of comes from this area of privilege. If you're able to think about your well-being beyond getting by from the day-to-day, is it this, concept of being privileged over in public health? We're trying to make sure that systems exist for protection purposes. And obviously you've talked a lot about this in a lot of your resources, and I've learned a lot from you myself. And I do think, like I said earlier, that people have different perspectives based on the area in public health they may work in, right? There's so many areas. There's, environmental, there's epidemiology. So I say this with a grain of salt because this is my personal perspective, but I talk about this with my students to try to get them to think about the good that public health is trying to do. And if we stay with protection, promoting health, those are great things. And we're obviously doing that. But at the core of public health, especially what we talk about in our department here at UNC Greensboro, is this idea of justice and equity. And if we're really thinking about and moving toward equity and social justice, then to me, naturally, the idea of wellness fits in there, because equity isn't just about providing a few solutions that should fit some people's needs. Sounds good. It's really about creating different approaches and individualized approaches to fit all types of people. And that's really what wellness is about too. And it may look different for different people, but so do some public health approaches, right? They look different for different populations, different geographic locations. And so, part of my soapbox usually, of course, naturally starts with NWI, or what's now known, of course, as the Wellness Alliance, is our definition that we always had, which is wellness is functioning optimally in your current environment. And that optimal piece, right, is that area of privileged or thriving, trying to get towards thriving versus just surviving or, being a productive citizen. And I tell my students that while wellness is individual and it does evolve because it depends on the environment and where you are and how that's interacting with you or vice versa, ultimately that environment, how you got to that environment, how you engage or interact with that environment, those things are all influenced by public health, right? The sidewalks, the seat belts. So just like I talked to you about earlier, if you live in an area and you need to go to the grocery store, number one, do you have a grocery store? Or is it convenience stores? Number two, when you go to the grocery store, what's offered? What's available? Is it local? Is it prepared, prepackaged foods? And number three, how did you get to the grocery store in the first place? And then, again, we could really dissect this. But then lastly, how far does your dollar go at that grocery store for where you're living? And all of those things are influenced by public health practices, policies, interventions, and approaches. And therefore, kind of create this cycle of the ability to engage in wellness or to kind of promote your own individual wellness. And I have this idea that we can't quite get people to think about elevating their wellness or thriving without also doing the work that has to be done and that should be done from a public health perspective of getting toward equity and that foundation of social justice. So I always tell my students, when we think about what we're trying to do from a public health perspective, the idea of wellness should always be in the back of our minds because we should be shooting for thriving, not surviving. When we're doing and aiming for what we're trying to do in public health, whether you're creating policy or a local community intervention to help with, diabetes, whatever it might be. And so that's really one of the large soapboxes that I get on. And I obviously always tie it back into some of these public health concepts and how we look at different health problems at different perspectives and levels. And I think that when we think about and understand how we engage with what's around us from a public health perspective, and then how that either supports or inhibits our ability to get towards a privileged sense of wellness or elevated sense of well-being, you really see that the two are more of a cycle or more synergistic, if you will, than I think people traditionally or historically have thought. And I think the more that we kind of think about it that way, the more that we're really aiming for elevating continuously from an equitable or a social justice lens to create that idea of thriving for our society.
Yeah, I love that. And that's something that I've tried to emphasize in my writing as of late is encouraging the wellness industry to zoom out.
Mm-hmm.
Is it zoomed in too much on the individual behavior choices and lifestyle choices? I mean, those are important, but I think that tends to blame the victim too much. And it's more responsible, I think, for people who really do want to improve the well-being of an individual or a population, that they have to zoom out and really take a hard look at the environment, as you mentioned, that the people are operating in. And my idea that I express in my book that you are just finishing up reading, Quick and Easy Wellness Law, of wellness legal partnerships to start with the workplace is just an example. I like to think of the workplace as a microcosm of the larger, society. And instead of workplace wellness programs being so laser focused on let's, do these top down paternalistic initiatives of taking, biometrics and offering different types of programs like walking challenges and lunch and learns and things, to really instead break down the barriers that employees face. And it's going to be different for everybody. Not everyone's going to have the same barriers that are getting in their way for an employee to really find a way to thrive. And so to use wellness legal partnerships as a vehicle to analyze the inside of the workplace and outside of the workplace, all of this different societal, social, structural determinants of wellness, I call them, that are getting in the way of someone achieving optimal well-being in whatever capacity or aspect of their life that might be. It might not necessarily be physical. It might be emotional. It might be intellectual. It might be spiritual. It might be social, but it might be economic. It could be all kinds of different things that if we just removed the barrier, if we identified the barriers and then removed those barriers or minimized them as much as possible, that might do more for promoting someone's well-being than telling them to walk 10,000 steps a day or, eat this food. But yeah, I'm totally on board with your soapbox that you give to your students. I think it's great.
Yeah, and I thank you, and I can't agree with you more. I do think that even though we know, and we teach it all the time in Intro to Public Health or Intro to Behavior Science, we teach all the time that one of the biggest things that happened from a health education perspective or just from a public health perspective, the more that we really got into recognizing health in the late 80s and 90s, it was that blame game. It was hyper focusing on those behaviors only and nothing else. Not looking at genetics, not looking at environment, family, geographic location, availability, or the economic situation of where you may live. And we know that, yet from a public health standpoint, although we teach that, we preach that, we work to avoid that again, somehow, to your point, the wellness industry found that as if that was the only way to go and really hyper-focused exactly how you said. And so people oftentimes, like I mentioned earlier, become disenfranchised with the way that our healthcare system or medical system works in the United States specifically. And they think, well, I'm going to take it upon myself and do all these things that I may or may not know if they're actually going to help me. And I may try to get to the 10,000 steps. I may try to increase my spirituality. All those things are likely things that are going to be positive, for your health and well-being. But will it actually solve or resolve the issue that's underlying as that barrier? Maybe, maybe not. And so I do think, and I could not agree more with that perspective of, yes, we're here to help with those behaviors, and there's so much information out there, and it is time to take a step back. And I think that's the scary part, because doing that requires, I think, more understanding and more agreement from a variety of levels of people to say, yes, we can't just continue to blame people's individual behaviors. There's so much more to the story, and that requires more work to do the digging, to understand those barriers. And that can be a little scary for some people, but we know ultimately that will create a better scenario for everyone to get towards that thriving and not just surviving.
Yeah. Well, based on your experience in the wellness industry, because you worked for NWI
Yes.
for years, do you think the wellness industry as a whole is ready to embrace a more holistic, zoom out view of what contributes to someone's well-being, to go beyond the lifestyle and behavior change that it's been so hyper focused on forever?
Mhm.
As we talked before I hit record, wellness the word is used ubiquitously. It's everywhere. It has, usually attached to that word is this aura of luxury, as you kind
Absolutely.
of mentioned. And if we start having a paradigm shift of what it means to be well, it's not just about going to the spa and, purchasing expensive products like eggs and that you can
Right.
on your parts, that it's more to get to that equitable piece, that justice and equity goals that you mentioned, that it requires us to zoom out
Mhm.
and look at the environment. Um, is there an appetite for that, do you think, within the industry, given that it's a huge, very financially lucrative industry? So that laser focus on the lifestyle change works. It makes people a lot of money. Um, so is it really going to come from the wellness industry, or would it more likely come from public health, which tends to be more, looking at social goods and be invested in what's best for the population? Although they're both of these industries have stigma attached to them. I mean,
Absolutely.
who's the better representative? Who's the better champion for this initiative, the
Mhm.
zooming out initiative?
That is a really good and difficult question. I have a few thoughts. And I think, to your point, the one side of wellness that is very individually laser focused right now, and not to say that it still isn't that way in the workplace, as you mentioned, it certainly is. Unfortunately, you're correct that a lot of the wellness luxury idea right now is definitely, related to money, right? What's happening from the influencers, what's happening on social media, what's happening with all these fast acting products. is not going to go anywhere anytime soon, because ultimately, and not everybody in the world is like this, right? We are a very interesting culture of Americans, and the way that we perceive health and how we should look and how those things are integrated. Unfortunately, I think that until individuals at large, right, masses of people realize that the quick fixes are not going to be forever solutions, and we can continue to tout that and support that and show that, I think it's going to be really hard to get away from this individualized, quick fix wellness industry that we see so much of from a social media perspective that is absolutely booming, right, from this influencer, perspective. The other part of this, I think that's interesting is, yes, it's making so much money, right? And we love numbers. And with the creation of AI and all the different ways in which we can get data is also helping, yet somehow also not helping, right? Because to your point earlier, and I don't remember if we were saying this when we were recorded or not, but you were very specific and correct in the fact that workplace wellness is so laser focused also on these individual programs, the STEP challenge, the BMI, getting this data, because that data can go back to supporting the ROI and VROI to, and even PROI to the leadership to say, hey, look, we had this many participants. This is what happened as a result. And we love those numbers, right? But I do think that the work site wellness side of things is starting to see this change in not only engagement participation because of people working from home. They're realizing that by working from home or giving that more, reducing those barriers to having to commute to work or giving them the ability to have a few days in office to leave early to pick up your kids, those are reducing barriers and increasing overall happiness and health and satisfaction as an employee. So I think the wellness kind of workforce and what we're seeing as employers is more willing to take that step back right now because of the data that we're seeing from all the employees who have had different shifts in their work as a result of COVID. And I think that might be a way to start and also integrate from our public health lens of getting this kind of like laser focus to take a step back and look at our lifestyle as Americans and how we work and what does that look like with trying to thrive. I think, unfortunately, the wellness industry itself, from an individualistic perspective of I'm going to keep buying these products, whether they're, they are doing the promises they say they're going to do or not, that I think will still continue to thrive. But what we see in other countries that happen to be successful in overall well-being and thriving comes from a reduction of that individualistic wellness purchase and finance part and an increase in employers recognizing what needs to happen to reduce those barriers as a result of the work that we can showcase from a public health standpoint. You look at the New Zealands, the Switzerlands, the Swedens, they're all showing just such great capacity for thriving and happiness and just a culture shift from a reduction in work, but from public health policies and changes beyond just traditional access to food, but obviously things like the medical system, nutrition, even parental leave and care. Like all those things are public health. And I think if we really trust public health and know what we're doing is correct and we know what we're doing here, and you can help us help ourselves to create those laws and to make those structural changes in our society, I think a lot of things will follow suit. But until that trust comes back and recognizes the work that we're doing is to try to drive those equitable forces and those ideas of social justice, we're going to continue to make sure that wellness industry booms, unfortunately. Fortunately for a lot of people, if it's working for them, that's great, but we know it's making a lot of money.
Yes. Well, so if I heard you right, the leadership for this zooming out, looking at the broader social structural determinants of well-being should come from public health. It really is in the domain of public health.
Mm-hmm.
Wellness doesn't probably, as a whole industry, doesn't probably, because it's doing so financially well, probably doesn't have the appetite to make
Right.
changes.
Right.
Well, no, it would benefit so many more people, but those concepts of equity and justice just don't resonate in the wellness industry right now. And so who's going to be the bridge, or do we need a bridge between these two industries, these two concepts, these two initiatives, public health and wellness? Can they continue to coexist, but not blend and not, work together? Ideally, they should work together, but is that possible? Is there an appetite to do that?
I think the appetite and is it possible are two different questions. The appetite may be there in some regards, it may not, because again, the financial success. Could it work and should it work together? I think absolutely so. I think your idea of a bridge would be great because one thing that I can, and my students know this as well, it's another soapbox that I have. One thing the wellness industry is really good about, and those who are the influencers and the brands and the marketing, it's that branding, marketing, and communication, whether it's truthful or not, as we know, right? Because right now it is really difficult for people to determine what's evidence-based, what's real, and what's just a bunch of garbage, unfortunately. And so I think that if we worked together from this public health landscape of this evidence-based social structures that we know will help drive social justice and equity, and with the branding and marketing and communication power of the wellness industry, I think we could do a lot of good in a lot, smaller amount of time. But that appetite is so large for that individualized approach of I'm this influencer or there's this product or this service that's just for you and it's going to fix XYZ. And we're over here thinking, well, if we just create better structures for parental leave, for children and their health needs in K-12 schools, if we do these things, then we know there are going to be better outcomes and we can prove it all day. We have the research to prove that. But jumping on that, train, if you will, might not be as exciting with the excitement of the brand recognition or, the different influencer support or whatever may be happening from this, whole wellness space. And I mention, influencers a lot just because, there are retreats, there are so many things we can think about with wellness. But right now, the hardest area I think to navigate is what you're seeing on social media and if it's valid and reliable information. And so I think that we have not done a great job from a public health perspective of investing in and maintaining branding, marketing, communication, and recognition for society to trust and understand how and what we're doing. And I think we could certainly learn from how fast and how quick and how successful the kind of wellness industry has been and the way in which they've been doing things for a variety of reasons. So I would love if there were some kind of bridge and more people like us to try to bring this together and say, hey, we need to be working together for the common good. And to do that, you have to stop thinking so much about the money and more about the outcome. And that is for healthier people, for happier people, and for a better future.
Mm-hmm. There's just so much. We could have another podcast just on, the free speech issues that you were mentioning and the need for evidence base and all that stuff. Because I just wrote an article on that. So we'll probably have to table that. But one thing I wanted to leave you and the audience with, based on what you said last, is, my experience with public health is that it has been sort of coupled with the traditional medical system. Historically, schools of public health sometimes are housed within schools of medicine. I know at University of Wisconsin that was the case for their school of health, public health, but they're often, identified as part of the larger medical system, even though they get a fraction of the dollars, and so I wonder, as just a thought to leave everyone with, if public health tried to maybe shift its gaze away from traditional conventional healthcare, which is rife with its own problems. I mean, we could have another discussion on how the medical system is not meeting the needs of most patients. I just read a headline today about appointment times for, to see your doctor are like increasing exponentially. It's not getting better. Everybody knows. Yeah, I'm sure you teach this in your class.
Yes.
We spend the most than any other developed country on healthcare, and we get the least value for what we spend.
Right.
I mean,
worst outcomes.
every study, hands down, no question, and it's not even close.
Right.
Those are not even close measures. Everybody is so much better at managing healthcare than we are. And our healthcare system, has a lot of problems. Patients aren't getting what they need. Turning to wellness, a lot of them, to get what they need, as you mentioned, I think, at the outset. Maybe public health should shift its gaze more to the wellness side of things to have more impact instead of investing so much association with the healthcare system. Just a thought. And that could maybe create more bridges and create more messages that actually get through and help more people.
Mm-hmm.
Anyway, if people want to learn more about your program at UNC Greensboro, where would they go?
Well, you can just Google public health education at UNC Greensboro. You can also
Okay.
look, we are under the School of Health and Human Sciences at UNC Greensboro. We have a lot of wonderful programs. And while I obviously oversee directly the undergraduate programs, we do have a master's program, an MPH program, and we do have a PhD program as well. And there's a lot of different public health programs out there, like you mentioned, and it really goes based off of what your personal fit and area of interest is within public health. And we have a focus on community health education, which really goes beyond just health education and really focuses on larger level changes to create a more supportive and I think equitable, like I've said a million times now, environment for those who, are more vulnerable. So that's what we're here to do in our program. And of course, we have, traditional courses like in health behavior science and policy, of course, in addition to a few other things. But we have a lot of really interesting faculty with incredible backgrounds. And so it makes our interaction with our students really special. Anywhere from, we have an acting PA on our faculty, from a doula to someone who specializes in working with immigrant and refugee health, and the list goes on. And so, of course, there are a ton of public health programs out there, but we have a lot of really wonderful ones here in North Carolina.
Wow, it sounds like a fantastic program. So I encourage everyone to check it out. And I want to just thank you, Suzanne, for your time today and for a really engaging discussion. We could have so many offshoot discussions from this one.
Absolutely.
And yeah, it was great to see you. And thank you for all the work that you and your school are doing.
Thank you for having me. It's been a pleasure. It's been an honor. And I'm sure we'll be in touch soon with all the questions and continued conversations around this.
Wonderful.
Thank you for listening to the Wellness Law Podcast. You can find more wellness law resources by visiting the Center for Health and Wellness Law website at www.wellnesslaw.com, where you can also subscribe to our newsletter and follow us on social media. Until the next episode, stay well, stay hopeful, and stay legal.